Hey everybody, this is Andrew Malkoski with the Denver 100, and I am once again hanging out with my friend Christina Hoffeld with Hoff Health, and we've been talking health insurance, the super exciting world of health insurance that is forever changing.
Yes.
So just like my market forever changing, your market changes for wildly different reasons, but I feel like it's been in the news quite a bit over the last couple of years. Tell us a little bit about what is changing in your world, the insurance world, how you're helping people. What do people need to know?
Yeah, so that's a really great question. I'll start with the super easy answer.
Okay.
Right now, Medicaid, the requirements for Medicaid are changing. They would like you to show that you can work or that you are actively working. Therefore, you're going to have different qualifications. It's not just going to be on income anymore. So in the past with Medicaid, for those that don't know what Medicaid is, that is insurance supplied by the government that is free or very, very, very low cost, and it's based on your income. State by state, that income is a range. It tends to average about $18,000, but again, that's just the range. So that demographic and under has the opportunity to get free healthcare.
Okay.
What it covers is your preventative care. God forbid if there's something more catastrophic, it would cover that just to make sure that you are able to get the care that you need and it doesn't have to be something more extreme.
Okay.
So there are people who are currently using Medicaid who, in the eyes of health insurance, the government, are able-bodied to be able to work, and they're not working, but
All
they're
right.
receiving these benefits. And so that's one of the new requirements that they put on. If you are deemed able-bodied to work, then that's how one of the other requirements it's going to be for your Medicaid benefits. So
Interesting. Okay.
yeah, and then other changes. So it's so funny that you asked that. I was just talking to my friend Violet, our friend Violet.
Yeah.
She is a marketing maven. She's incredible. There's a series that I want to do. I get newsletters every day, sometimes multiple times a day, with regards to health insurance and the changes. And it's written for brokers. So there's a lot of convoluted talk. What I'm doing is I'm summarizing, and it's going to be a series on some of my social medias.
Oh, very cool.
That way people can access super easy and say, okay, well, this change is coming, could be coming. This is what it means really quickly, as opposed to reading these very long articles and saying, oh my gosh, I feel like I've just read in circles. I don't know what any of this means. And so I'm summarizing. That way it's just more attainable. So everybody seems like they're in the know. And when open enrollment comes, it's not this kind of shock and awe. The other caveat that I will give is, open enrollment is always the indicator of change because it's a period of time in which the marketplace is open to anybody who would like to enroll, but none of the changes will go into effect until then. They're also estimating that some of these changes won't even go into effect until 2026. So that wouldn't apply to 2025. We're still seeing what that information is and how that's going to look.
Okay.
That's why I'm not like, this is what the change is going to be exactly, right, because I can't say that.
Right.
I can say, hey, here's the information that we're being given every single day.
Yeah.
And this is the interpretation of what that could or could not mean. So
fair enough.
Yeah. Well, I don't want to give false information and then have everybody kind of in a panic or
right.
think, oh, we're great, everything's fine, and then here's this whammy. That's the worst. The worst. So
one of the questions I have to blindside you with here when it comes to changes, how is it that there are some insurance companies that work in some states and not others? How does that work?
Oh, yeah. So that's a great question. So it has to do with the types of insurance that you have.
Okay.
So most, and this is not all, most state-run exchanges or things that you can get from healthcare.gov, so the marketplace, are HMOs. So what that is health insurance that works in your area, your state
Okay.
only. Now, part of the ACA or marketplace, it has to cover emergency care if you are outside of that area.
Right.
Let's say you decide, because you're an avid skier, you're going to go to ski in Utah rather than ski here in Colorado because you've done everything here.
Right.
And you fall and break your leg coming down the slopes. Well, they'll cover the emergency care in Utah. And then anything after that, let's say you needed pins, plates, screws, surgery, something like that. Yeah, exactly. Ugh.
Yeah.
You can become bionic.
Wait, I'm all for that part.
Right,
But so you have to come back to Colorado for
yeah,
that.
well, I mean, right, because that's when the insurance company can decide what's emergent, what's not. And then they can say, well, you're out of network, so because you needed this surgery and you were out of network, we don't have to pay for it. And so it's something that I talk to a lot of my clients, again, when we're assessing needs.
Yeah.
Hey, are you that person that's like, nope, I'm a homebody, I don't ever go anywhere other than my little bubble,
Sure.
right? Then those are perfect for you, right? If you are somebody that travels a lot, there are other options for you.
Interesting.
And those are called PPOs. And so that gives you a lot more selection. And they work in all states across the country. It's just we would have to find the network within that state.
Interesting.
And it's something that I can do. I can search networks super easy, because I don't expect anybody, oh my gosh, I'm in the ER, let's search my network. Like, that's not how that works. Like,
no. And it's more like every once in a while you hear like, oh, such and such a company is pulling out of the Colorado market, or there's, hey, there's a new person or company or whatever. I was just curious how those changes work. So
yeah, and honestly, let's just be super real. Insurance companies, it is a for-profit business. And anybody that thinks otherwise is, delusional.
Yep.
And so that's okay, because that's what business is. We're all trying to make money, get by.
Absolutely.
But the idea that they are going to be altruistic, that's like asking some of the big box grocery stores to do that, right? That's just not a thing. And so that's why having somebody on your side who understands some of the back end stuff is really, really valuable. So
really valuable.
Yeah.
Well, thank you for coming and hanging out with me today.
Yeah, this has been fun. Thank you so much, Andrew.
Thanks for tuning in. It has been a pleasure, and we'll talk at you later.